Guys, welcome. Today we are going to talk about 15 reasons why you experience pain during sex. 15 reasons why you experience pain during sex. Guys, experiencing pain during sex, also known as what you call dyspareunia. Dyspareunia can be distressing and may indicate an underlying issue that requires attention, and that's why I've chosen to give some of the 15 reasons why you experience that pain during sex. Number one, and the primary cause, is what we call lack of lubrication. And when we talk about lack of lubrication, we are talking about insufficient lubrication that can lead to friction and discomfort. Where we have lack of that lubrication, we have a lot of friction and also a lot of discomfort during the sex. But this can be helped by using water-based lubricants that can help reduce the friction and also make the intercourse more comfortable. Number two cause of the pain is about vaginal dryness. Because vaginal dryness can be because of hormonal changes, menopause, breastfeeding, certain medications can also cause vaginal dryness, leading to discomfort during sex. Number three cause is infection. So yeast infections such as what you call bacterial vaginosis can cause, and also we have some sexual transmitted infections which can cause inflammation and discomfort in the genital area. Also, we have pelvic floor dysfunction, like when we have weak or tense pelvic floor muscles can contribute to pain during the intercourse, and pelvic floor physical therapy or exercises may help improve the tone and alleviate the discomfort. Number five cause is about what we call endometriosis. Is a condition in which a tissue similar to the lining of the uterus grow outside of the uterus. This can cause pelvic pain, painful periods, and also pain during sex. Number six cause is what you call interstitial cystitis. When we talk about interstitial cystitis, is a chronic bladder condition characterized by pelvic pain, urinary urgency, and also frequency. So intercourse may exacerbate the symptoms and cause discomfort. Kindly, if you have not watched our previous video, I did something on interstitial cystitis. Kindly, you can go and watch about our urinary system. The video is on the title urinary disorders. Kindly watch about what is the interstitial cystitis and what it entails and the management of the same. Number seven cause is about vulvodynia. Vulvodynia is a chronic pain condition affecting the vulva, and also vulva is the part outside the vagina. So it's characterized by burning, stinging, and also stabbing pain. Pain during sex is a common symptoms of the vulvodynia. So vulvodynia is one of the number one cause of that pain during sex. Also number 8, which is what we call vaginismus, which is characterized by the involuntary muscle spasms or pelvic floor muscle of the pelvic floor muscles. So they making penetration very painful or impossible. There is a time where now the vagina really closes because of the involuntary closure of those muscles. So we have either the man cannot enter, or introitus becomes very painful when entering, or it is impossible to enter. Number 9 is what we call scarring or trauma, can be the cause of this, because scarring from the previous surgeries or childbirth or trauma to the pelvic area can cause pain during the intercourse. Number 10 is about cervical issues. Conditions such as cervical ectropion, cervical stenosis, or cervical dysplasia can cause discomfort during the penetration. Number 11 is about uterine fibroids. Uterine fibroids are non-cancerous growths in the uterus, and this can cause pelvic pain, the discomfort during sex, especially with deep penetration. Number 12 cause is ovarian cysts. Ovarian cysts they are fluid-filled sacs that develop on the ovaries. So large or ruptured cysts can cause pelvic pain and discomfort during the intercourse. Number 13 is about what you call PID, or pelvic inflammatory disease, which is an infection of the female reproductive organs, often caused by sexually transmitted bacteria. It can lead to pelvic pain, discomfort during sex, and also fertility problems if it is left untreated. Number 14 cause is about allergies and also irritants. Allergic reaction to the latex, especially the condoms, and also spermicides, and also replicants being used, or personal care products like oils which one applies on the skin, can also be the cause of the pain during the intercourse. Number 15 cause is about psychological factors, when one is stressed, one is anxious, relationship issues from the experience, past trauma or negative sexual experiences can contribute to the pain during the sex by increasing the muscle tension, and also when this comes up, it interferes with the arousal and also replication. Guys, it is important to consult with the healthcare provider when you experience pain during sex to determine the main cause, because like I've mentioned, we have very many causes. They are like the ones I've mentioned above, like dryness, like PID, we have and the ones which I've mentioned, up to 15 of them. So go to your doctor to identify the cause, because the cause is very important, so that the approach can be employed as appropriate. With proper diagnosis and management, many individuals can find relief from sexual pain and also enjoy pleasurable, comfortable intercourse as appropriate. How can we prevent pain during sex? Preventing pain during sex involves addressing underlying factors that contribute to the discomfort, and I'm going to give you some preventive measures which you can employ to avoid that pain during sex. Number 1, ensure sufficient replication. Use water-based replicants. Like here in Kenya, we use most of the time is what you call KY. And kindly don't use those products like Vaseline and also the skin products to make it replicate, because of that the other effects of the same. So these water-based replicants, it must be water-based, because also the other ones can cause you a lot of problems and also can predispose you to infection. So these water-based replicants, they make you comfortable, and also they address the vaginal dryness at that particular point. Number 2, communicate with your partner, because like it's always said, sex is always in the mind. So communicate with your partner about your needs, preferences, and also discomfort you experience during sex. This can help ensure mutual satisfaction and a comfortable sexual experience at that particular point. Number 3, practice relaxation techniques. Engage in relaxation techniques like deep breathing, mindfulness, or progressive muscle relaxation to reduce muscle tension and promote relaxation before and during the sexual activity. Number 4, address hormonal changes. If hormonal changes contribute to the dryness or discomfort, discuss hormonal replacement with your doctor so that the treatment option with your healthcare provider can be achieved at that particular point. Number 5, manage medical conditions, like seek appropriate medical treatment of the underlying conditions, such as infection, if you have endometriosis, if you have PID, pelvic inflammatory disease, also pelvic floor dysfunction, interstitial cystitis, to alleviate these symptoms so that the symptoms can be subsided, so that you get to enjoy the sexual activity. Number 6, explore pelvic floor therapy. Consider pelvic floor physical therapy or exercises to strengthen or to relax the pelvic floor muscles and improve pelvic floor function, which can help reduce the pain during the sex. Number 7, use gentle sexual practices, such as engage in sexual practices that promote comfort and pleasure. Such as number 1, extend your foreplay, and also sensual massage is very important, so that one gets prepared, and also non-penetrative activities to enhance arousal and also to make your partner relax or make you relax. Number 8, experiment with different positions. Explore sexual positions that minimize pressure on sensitive areas or allow for greater control over depth and also pace of penetration, such as side lying, spooning, or woman on top of positions. They can help one take control so that you don't experience a lot of pain at a particular point. Number 9, maintain good sexual hygiene. Practice good sexual hygiene by using clean hands, washing genital areas before and after sex, and avoiding harsh soaps or products that may irritate the sensitive skin on your private or in your vagina. So maintaining good sexual hygiene is a very important aspect by cleaning always cleaning your hands, washing genital areas before and after sex, and avoiding harsh soaps or products that may irritate the sensitive tissues surrounding your genital area. Also, very important, address psychological factors by seek support from the therapist or the counselor to address the psychological factors such as stress, anxiety, relationship issues, or past trauma that may contribute to the discomfort. Number 11, avoiding allergens or irritants. By identifying and avoiding allergens, we mean to trigger which may trigger the discomfort during sex, such as latex, spermicides, lubricants, or personal care products, so that you take care of the allergens. Number 12, stay hydrated. Drink a lot of water to maintain hydration. They help in improving the vaginal replication and also reduce the risk of discomfort during the intercourse. Number 13 is about practice safe sex. Protect yourself from sexually transmitted infections by using the condoms or other barrier methods during sexual activity, especially if you have multiple sexual partners, because you are at risk of getting the sexually transmitted infection. Number 14 is about seek regular gynecological care by attending regular gynecological checkups to monitor your reproductive health and also address any concerns, and receive preventive care and also things like cervical screening, such as and also other screenings for infections and also cervical abnormalities. Number 15, stay informed. It's very important. Information is power. Stay informed about sexual health and wellness by educating yourself, like the one I'm doing, especially about your anatomy. Know your anatomy very well, ladies, and also men, know the anatomy of your partners. Sexual function, also get informed over the same. Common sexual concerns, get to also to know them, because knowledge empowers you to make informed decisions about your sexual health and also seek appropriate care when needed. By taking the proper steps, guys, to address potential problems, also contributors to the sexual discomfort, and also prioritizing open communication, relaxation, and pleasure can help prevent pain during sex and enjoy a fulfilling and satisfying sexual relationships. How can you prevent pain during sex? Number 1, we talked about communicating with your partner. Open and honest communication. And when we talk about communication, be open, don't make the other person feel good. Be open and also honest. Communicate with your partner about your needs, desires, and discomfort you may be experiencing. Engage in extended foreplay. Use replication, as I've mentioned. Explore different positions. Address underlying medical conditions. Pelvic floor therapy. Also, use of warm compresses can also be employed at that particular point, so that you improve the increase of blood and also reduce discomfort. By taking a warm bath or a shower can help relax the body and promote relaxation before the intimacy. Number 9, practice mindfulness and sensate focus. So it is also very important, where you stay present and focus on the sensation during the sexual activity, which enhance the pleasure and reduce the anxiety or the distraction. So sensate focus exercises involving exploring touch and sensation without the goal of orgasm, helping partners connect and communicate with more effectively. Number 10, counseling can be handy, counseling therapy. So consider seeking counseling or therapy addressing the emotional or relational issues which contribute to the sexual discomfort, such as stress, anxiety, trauma, or relationship conflicts. So a therapist can provide guidance and a tool to improve communication so that one gets to sexual satisfaction. Number 11, use gentle touch. Be mindful of using gentle touch and pressure during sexual activity, so that especially around the sensitive areas like the clitoris and the vagina and the perineum, to avoid rough or aggressive stimulation that may cause pain or discomfort. Number 12, take breaks when needed. Listen to your body and take breaks as needed during sexual activity. If you experience pain or discomfort during the activity, communicate with your partner and take time to relax or to rest, to explore other forms of intimacy. Number 13, stay hydrated and health. By maintaining overall health and well-being of staying hydrated, eating balanced diet, getting regular exercise, managing stress, prioritizing self-care, physical health and vitality can positively impact sexual function and also comfort. Number 14, use sexual wellness products. Like explore sexual wellness products designed to enhance the comfort and also pleasure during the sex, such as what we call economic sex toys, vaginal dilators, or also gels. Experiencing with different products and techniques can help you find what works best for you. I know this is what most of the gynecologists don't advocate for because of other issues, so it's something which you can consider cautionary and make a proper choice over the same. Attend couples counseling can also help. Consider attending couples counseling, where your partner also attends that counseling, where you address your concerns and also communicate. Yes, consider couples therapy, where your partner also attends the same with a trained therapist, where we can facilitate the conversations, especially where we have communication barriers and also relationship dynamics, so that you get to strengthen your relationship and enhance sexual experience and enjoy it. By implementing these preventive strategies and prioritizing your physical and emotional well-being, you can reduce the likelihood of experiencing pain during sex and cultivate a more fulfilling and enjoyable intimate life with your partner. If you continue to experience pain or discomfort despite these efforts, consult with your healthcare provider and also sexual therapist or further evaluation and guidance tailored towards your needs. Guys, I know sex is a very, especially discussing matter sex in an African setting, sometimes is a taboo, but it is what it is, guys. We need to discuss these things candidly and tell each other the way it is. That's why we are in this channel, Nasfin. Kindly, if you have not subscribed, I want to encourage you to subscribe. Give us a nice comment below. Guys, we are not giving our videos likes. Kindly give us those likes, because that is the way you get YouTube to recommend our videos to the larger populations, because we want many people to get this information the way it is, guys. We love you so much, and I want to welcome you to our next video, guys. Peace, guys.